The huge jump in COVID-19 cases across the U.S. is causing a triple threat of problems: rising hospitalizations, a shortage of tests, and staffing issues in healthcare facilities and beyond. In Kansas, the governor has issued a 15-day disaster declaration to deal with healthcare staffing shortages. In New York, 40 hospitals have stopped non-essential elective operations because COVID patients are filling so many beds. And California is deploying 200 National Guard members to 50 COVID-19 testing sites to help with clinical staffing and crowd control. In the last few days, thousands of students from the Los Angeles Unified School District have formed long lines outside of testing centers. District officials are requiring all students get tested before the start of their spring semester on Tuesday. In Minneapolis, several churches canceled Mass Sunday after nearly 24 priests tested positive for COVID. And in Chicago, the teachers union and city officials resumed negotiations Saturday. They're trying to end a standoff over COVID-19 precautions. Students have already missed 3 days of classes, and schools are expected to be closed for a fourth day on Monday. CBS News correspondent Mark Strassman has more on the many problems caused by the spread of the Omicron variant.
Those people are not in line. Don't give them one.
It's the same scene all over. Americans on a scavenger hunt for COVID tests.
At this time, we are sold out of COVID tests.
Empty shelves, long lines. Colorado, Indiana, even Massachusetts, home to one of America's highest vaccination rates. And yet somehow Florida, long a bullseye for the virus, managed to let up to 1 million COVID tests expire in a warehouse. One critic called it heartless.
There wasn't a lot of demand for them. They've been sending them out as requested.
COVID anxiety and COVID testing are both spiking now that the holidays are behind us. This is Glynn County, coastal Georgia. 6 times as many people lined up for tests the first week of January than the week before. Omicron now surges everywhere with astonishing speed. Contact tracing's virtually worthless. Consider this. It took 6 months for the U.S. to report its first 4 million cases. The last 4 million took 1 week. This is Southeast Georgia Health System near Savannah. Its COVID patients more than doubled in 1 week.
Every bed's taken, the ER's full.
Nurses like Macy Floyd keep running a COVID marathon.
I don't know when a finish line will be. I don't see one. I think COVID is something we're going to be dealing with for a while.
Even more worrisome, the CDC says pediatric hospitalizations have hit a pandemic peak. Mostly children under 4, too young for the vaccine. In this week's COVID follies, the CDC's ever-evolving, consistently confusing guidance. Nearly 2 weeks ago, the agency halved its isolation recommendation for infected people from 10 days to 5. Then rejoin the world without passing a test first. Its new guidance: taking that test is up to you.
If that test is positive, people should stay home for those extra 5 days.
The American Medical Association is having none of it. Those recommendations are not only confusing, but are risking further spread of the virus. Experts predict Omicron's surge across the U.S. to peak soon. But no question, our next couple of weeks will be rough. No need to worry about an Omicron booster. There's not enough time to develop one before this COVID surge passes, all of which leaves many people resigned, Lana, that sooner or later, everyone is going to get it.
Hear that more. Mark, thank you. Joining us now for more on this is Dr. Stanley Perlman. He is a professor of microbiology, immunology, and pediatrics at the University of Iowa. Go Hawks. Dr. Perlman, let's start off with what we just heard my colleague Mark Strassman report, that more and more he is hearing from people that it seems like they are just putting their hands up saying eventually we're all going to get COVID. What do you think about that?
Well, I've heard that before, and there's some truth to it. This virus is not going away, and for a long time I've thought it was not going to go away, that it was always going to be part of our virus, what we're exposed to. So yes, I think we are going to have to live with it and how to do it.
Well, it's also widely known that COVID-19 testing shortages are a major problem across the country right now. How might this be impacting efforts to try and slow the spread of the virus? And if the other part of what we're discussing is true, why is it still so important to try and slow the spread?
Well, testing is, of course, key to knowing where the virus is and how many people have it, and also potentially to find out when people are no longer contagious, but most important to find out how much virus is around. So it's always been crucial, and the U.S. has almost always had too little testing to really keep on top of the virus spread. And the reason we want to slow the spread of the virus is for two reasons. First, if we slow the spread, it gives people more time to get vaccinated if they're going to get vaccinated. And it also takes some of the pressure off healthcare facilities, because that's really one of the major problems we're having now. Healthcare workers are getting overwhelmed and exhausted and infected. So both those things will result if we have more testing and we know we can slow down the rate of the spread of the virus.
Well, critics have knocked the CDC's latest guidance as contradictory and confusing, especially the testing and quarantine procedures. So help us understand, Dr. Perlman, when should we get tested? When should we isolate? For how long? And should we get tested before returning to work or school?
Yes. So this all started with our knowledge that testing by PCR, which is the best way to do it, is imperfect in the sense that it's very sensitive. So people could remain positive by PCR, but be unable to spread the virus after about 9 or 10 days. So PCR is a surrogate for having virus that can spread. Now, we also know that most of the viruses spread 1 or 2 days before people become infected and 2 or 3 days afterwards. But we know some spread continues till day 9 or 10. So the original recommendation said people should be isolated for 9 or 10 days after being positive to allow the virus to go away. And the new recommendations more focus on the fact that the most common time of spread is within 2 days before or 2 or 3 days after. So one picks up probably 80 or 90% of all the possible spread. But you still have 10% left, and this is where the disagreements occur and the confusion occurs. The CDC changes its recommendations based on comparing these two facts. Now, the second part of the problem is, what does testing do for you? Well, the virus we know won't be around after 9 or 10 days. Virus antigen tests, such as the Abbott tests, which are, by the way, very hard to find, these tests are not super sensitive, but they may be good because they tell you whether there's enough virus around to possibly be contagious. However, they don't guarantee that there's virus there. They just tell you that parts of the virus is there, the protein of the virus. So it becomes very complicated. And yes, there should be a single message from the CDC. It would definitely help people figure out what they need to do to go back to work, back to school. I personally think that testing, certainly after 9 or 10 days, is not necessary and probably undesirable. After 5 days, it's much more controversial because there could be some virus left in some people, but testing is likely to pick up people who are not contagious as well. So that's where the quandary comes in.
So what would you advise our viewers to do? Because I hear you that that's the quandary, that's what people are facing, this level of confusion. Do you think that people ought to be taking one of those rapid tests after 5 days, or if they're feeling good, or and tell us also how having symptoms, which symptoms are still problematic in terms of re-entering society?
Yes, so I think I'll take the second part first. I think that if one has symptoms, one should certainly go for the 10 days rather than the 5 days, because one wants to be symptom-free by the time one goes back to work or school. And another question is, what is the time that you start counting the 5 or 10 days? Certainly, if you've been sick for 3 days and then get tested, I think that the counting should start from when you first had symptoms, and I think that's what the CDC says now. The testing itself may not be really the time of zero that you should count as the first day. So in terms of what one should do, for a lot of things, I'm a fan of the 5-day recommendation because it's basically safe, and if people are doing other measures like wearing masks and mitigation, and it's particularly if they've been vaccinated, I think 5 days is very safe. Now, on the other hand, if people are not wearing masks or if they're not vaccinated, then I might follow a 10-day rule. So you can see that I'm as unclear as the CDC because it's so nuanced here. You know, there's so many possibilities. I would hate to send somebody who wasn't vaccinated back to a position where there's somebody susceptible around them, and it's only 5 days.
I think it's a fair point, though, that trying to diagnose society writ large as opposed to individuals on a case-by-case basis. I'm putting you in a difficult position in that. But it does sound like the consensus is that if you're feeling fine, it's been 5 days, you have a rapid test and it comes back negative, you should feel free to go back to work or school. But even then, you should still remain masked up. Is that a fair? Did I make that sort of plain enough and get it right?
Yeah, I think that that's fair. And I don't even know if at the 5-day mark, a positive test, if you've been fine, particularly if you've had almost no symptoms but were just positive, I don't even know if you need that. That's why the CDC said initially not. Now they're saying maybe if you like to.
Dr. Perlman, this question keeps popping up in a lot of high-profile places. Do people who have had COVID-19 still need to get vaccinated? How long does that clock potentially last for coverage for them? And what are the advantages to somebody to get vaccinated even after they've had COVID?
Yeah, so there's definitely advantage to being vaccinated. One has a very strong immune response to the virus and very well protected for a longer period of time. And we think that vaccination is actually better than the natural infection in most cases for protecting people from re-challenge with the virus. So yes, people who have been infected should wait. I think the recommendation is 2 or 3 months now, and then they should be vaccinated because they will have a good immune response that will protect them better than the infection itself. We know that for sure. In fact, the best combination, not that I recommend it, is infection plus vaccination. Those people have the very best responses.
Well, according to some experts, you know what, actually, even before I get on to talking about cloth masks, how long, though, does that last, that additional level of immunity that comes from having been infected with COVID-19? Because we're now 2 years into the pandemic.
Yeah, this is a question that's still evolving because the Omicron variant is a little different than the previous ones and it doesn't respond as favorably for us as the earlier ones did to vaccination and to prior infection. So some of the antibodies that we produce to no longer recognize the Omicron variant. So it's really a key question: how long do we have? How long will protection last? There's a lot of studies that show that if one just had two injections of the vaccine or was just infected, that the Omicron variant pretty much evades that immune response. So we still need to find out how long this will last. We don't even know if Omicron will be the variant that will be around with us in 6 months. This virus changes so much. So we still have to sort that out. That's really an important question. How long does protection last? Will we need boosters? Will we need a booster that's specific for a virus like the Omicron one? Or can we use the original vaccinations?
Another reason for people who have previously been infected but are unvaccinated to get those vaccines now. I was starting to ask you, though, about cloth masks because we've started to hear more and more experts say that they are not protective enough against the Omicron variant, which we know is particularly contagious. What kinds of masks, then, should people be wearing instead? And does it matter for kids in particular?
Yeah, so I think we've known for a while that cloth masks are good, but not as good as surgical masks, the ones that people wear in the hospital. And they're not as good as what's called the N95 masks or the KN95 masks, which filter out 95% of particles. So that's where that argument came from. Since Omicron is so much more contagious than these other variants, then the curve, as it were, shifts over. So a cloth mask that might have protected against one of the earlier variants just won't protect against Omicron. So that's why it's being recommended that they not be used. So that's where it comes from. One has to put this all in context because if one goes into a bar wearing a mask, the best mask, and there's tons of virus in the air because it's a closed area, it's not ventilated, there's still a chance that one will get infected even under those circumstances. If one is in an area where there's wide open spaces and there's 4 people in a huge room, a cloth mask will probably work. So the balance is that one should probably use a surgical mask because one usually isn't in a giant room where there's only 4 people. So one wants as much protection as one can get. So a surgical mask or what's called an N95 mask or a KN95 masks, but those are really the best ones, are better than cloth masks. And KN95s and N95s are better than surgical masks.
And for kids? Just try and get them to wear the mask is basically what I'm operating with.
So I think that's a bigger problem. If KN95s or 95s might be better, but they might be so uncomfortable that a child may not be able to wear them. Certainly for children over 5, getting vaccinated is the very first thing they should do to prevent the surge in infections in pediatric hospitals that we're seeing. Not that many kids are vaccinated, so that's really the best thing to do. As much as one can at school, one should practice social distancing, but social distancing a 6-year-old is virtually impossible. So it's very hard. So people, I think vaccination and being as careful as one can and making kids wear masks as much as one can without it being a huge hurrah for the children. That's the best way to go. I know I have 10-year-old or 9-year-old grandchildren who routinely wear masks all the time. So they were taught to do it. In fact, for a while, it took us, I live in Iowa, they came from New York City. It took a while for us to convince them that they don't really have to wear masks when they're outside in Iowa. It's more an issue when they're inside in New York. So they can be taught that this is the right thing to do, and at least at that age, can appreciate it.
All right. Dr. Stanley Perlman, thank you.
You're welcome. Thanks for having me.